recipient of 2006 Young Investigator Award from Aplastic Anemia MDS Research Foundation. So it supported my research in genomics of MDS. So the funding allowed me to carry out research in, especially in MDS, aplastic anemia, and PNH. And what we knew in 2006 was that MDS was probably a genetic disease, but we didn't have good tools to analyze that. So after I was granted this award, we applied these new molecular techniques in MDS, and we basically were able to find the new genetic lesions in the 50% of the patients that were previously thought to have normal cytogenetics. And that was pretty important because we found this new type of lesion called UPD, which is pretty common in myeloid diseases now. And also it allowed us to find new mutations in MDS that we know are very important right now in all myeloid diseases. So receiving a grant had, I think, impact on the multiple levels of my career. So the first, it provided the funds to carry out my research, and that I think was very important for a young investigator with no really prior experience or track record. So that was a tremendous resource. And I think at another level was just by mentoring and seeing and meeting people during the meetings like this one, when you can actually interact with experts in the field. And it's pretty amazing because you read those papers, you see the names, and finally you have an opportunity to actually meet them in person, and it was very uplifting, so I appreciate that. So my first part of my research focused on discovering these new genetic lesions, and now we know there are a lot of mutations in MDS and even aplastic anemia and PNH. And we don't quite understand the mechanism by which those mutations are affecting the disease and progression of the disease. So I think the next several years, hopefully, we'll have a better understanding of the mechanism of the disease. And once we know exactly how they act, we can potentially target this either pathways that are activated in cancer, or epigenetic lesions or modifications in the DNA. So hopefully we can be able to help patients with MDS, not necessarily with bone marrow transplant, like we're doing right now in MDS, which is the only curative approach, but maybe we can use drugs or small molecules that can target these pathways, and hopefully we can prolong survivals and at some point cure the disease. AA&MDS Foundation, I think, has been very important in my career development, and not only providing funding for my research, but also the annual meetings, bone marrow failure meetings, have been of tremendous significance to me, and especially that in such a small group of people, very well known in the field, expert in the field, you can connect with them, you can get new ideas. You can actually see the trajectory of the research for the next several years, where did it come from, where it's going. So that's been very, very helpful, especially for young investigators. So I think that funding from AA&MDS Foundation is probably even more needed right now. And we know that the government and federal funding are limited, and it's extremely hard for a young investigator to successfully apply for any type of funding. So I think that's where AA&MDS Foundation comes in and helps a young investigator to carry out their proposals and research. So I graduated, I'm from Poland originally, so after I graduated from medical school, I met my mentor, a former mentor and my friend right now, Jarek Maciejewski, who was the chairman of the session in Germany, in Berlin. And he offered me a position in the United States. I was a last year medical student. So I think it took me a year to make up my mind and come to Cleveland and work in Jarek's lab. So it's been a great experience, and Jarek's been a great mentor, and he mentored a lot of young investigators who are right now very successful and very known. So hopefully I'm one of them at some point. And I remember the story, and we applied for AA&MDS Foundation Award, and it was this new molecular technique that we wanted to apply to MDS patients, and the only problem was it was really expensive. So that's why we applied for funding, and I remember he told me like, oh, don't worry, if it doesn't work, like you'll just be working for free for the next 2 years for me. So I was actually lucky now it worked. So we've been having a blast with the research, and it resulted in numerous publications. So I've been thankful for that and for your support. So first of all, I would like to thank everybody who made it available for young investigators to do research in bone marrow failure. And I think right now, especially nowadays, it takes a lot of effort for young people to make this decision and stay in academic medicine and do either translation or clinical research. And I think the funding like that and support of AA&MDS Foundation will encourage more people to actually devote their careers to do research in bone marrow failures. And maybe like me, they'll find a passion in doing that and helping patients with the disease.